when digital capabilities or software are developed in one country, they then can be applied to different health services across the world. And those standards they exist to a degree, but they're not strong. And I can see a huge advantage of us working together on this, because there's no doubt that the work that's happening in India will have an impact on the whole world in terms of strengthening healthcare when you bring these digital capabilities to the fore. And then on clinical trials, given that India is the biggest producer of generic medicines in the world, making sure that we speed up the flow of new medicines through the research end of the system can only benefit all of us.
You already know that we are, even at the World Health Organization level, we are chairing that group of which already more than 30 countries have already joined that, and India is there also. We are not only leading, we are still very aggressively, in fact, pushing this digital thing. And recently, this COVID platform that we developed, I think that's probably one of the most sophisticated platform that we developed, and through which we are trying to deliver vaccines to our people in a country of 1.35 billion people. So, and then of course, you are right in saying that clinical trials, I think right now, when you do some clinical trials, whether it is for a drug or a vaccine in a particular country, then the strong positive outcomes of those results, they should all be, I think, shared with the whole world. And I have said it many times that, you see, the technology could be local, but the science has to be universal, and the fruits of science have to be shared by everyone all across the globe. Apart from the routine methods of controlling the pandemic, about strengthening by testing, tracking, treating, and all that we were able to do, now it's all being supplemented with the vaccination of the community also. And we had started with priority groups, and now even the 18 to 45 lot is also being slowly vaccinated. And of course, the priority still remains the people above 45 years of age. And more than 20 crore doses have already been given. And simultaneously, we are ramping up the production capabilities of the country. The present vaccine manufacturers, they will also be able to produce vaccines in higher numbers in the coming months. And then another almost half a dozen new vaccine manufacturers with new vaccines are also likely to come up in the coming months. And our estimate is that by the end of this year, we should have over 2 billion vaccine doses in the country between August and December only. So we have a very ambitious plan. We are working on it very, very meticulously, monitoring everything very committedly.